Yes, Tim. I am an aesthetic dermatologist who specialized in laser surgery. And my career has been quite international. So I was trained as a dermatologist in Belgium. Then I moved to the Netherlands to do a subspecialization in phlebology. And after that great experience, I moved to the States, where I started in California to do a fellowship in laser surgery. Then I went to Madison, Wisconsin at the university, where I did a Mohs surgery fellowship. And I eventually ended up in Boston in Harvard Medical School with Dr. Rox Anderson, the father of laser surgery. And here I was for 7 years involved in research, developing different kinds of lasers. I use a very particular laser that will not aggravate the melasma, because it's a very sensitive skin disorder. If you're too aggressive with your treatment, it will get worse. So I know which treatment parameters, which laser to use depending on the skin types, but I always combine it with the HydraFacial just before and after the laser treatment. So what I do before are the first 2 steps, which is the exfoliation and then the peel. The peels are very soft and will not trigger irritation in their skin. After I did those 2 first steps, the skin surface is very even. So when I do then my laser treatment, there will be less reflection and scattering from the light. The light will penetrate deeper and more efficiently inside the skin, where it will do its specific treatment on the melanocytes. So immediately after the treatment, I perform then the last step of the HydraFacial treatment, which is the infusion, where I use the butanol with the pigment lightening agents, and of course afterwards we apply a sunscreen. And I find the combo treatment more effective than the laser treatment alone, because I pre-treat the skin for optimized laser treatment, and immediately after I apply a lightening agent on the areas of concern. Rosacea and sensitive skin is a main concern to a lot of patients. So again, my strategy, very simple, we take pictures. When you have sensitive skin, patients report that they cannot tolerate a lot of products, that everything stinks. And if you look at the polarized pictures, you see a chronic inflammation inside of the dermis, which is an objective indication of that sensitive skin. One step further is then the typical rosacea, where the vessels start to dilate and you see the individual vessels on the nose, the cheeks and the chin. And it can go even further, where patients develop some kind of an inflammatory acne with papules and papulopustules. So what is common in those patients with sensitive skin, rosacea or acneiform rosacea, is that their skin barrier is impaired. They don't have a strong external skin barrier. So the first approach is then again to educate them, to tell them which are the right products to clean your more sensitive skin. What can we do to repair that skin barrier, to reduce the sensitivity? That is again home care. 6 weeks later, we are going to implement personalized skin treatment, which I always do with the HydraFacial. I found it remarkable how that sensitive skin tolerates the exfoliation, the peeling very well with HydraFacial, because we can use the adapted products like the Rosa Triol, adapted for that skin type. So we are dealing with first making the skin stronger with the right skincare products. Secondly, reduce the chronic inflammation with the HydraFacial treatment. And then if there are broken vessels, also part of the symptoms, then we will use the laser to treat the broken vessels.